People right now, provider organizations right now, are really worried about moving from one type of care delivery and one type of payment to another. If you look at what utilization means right now in healthcare, utilization is how you get paid. It's your business is sustainable if you can drive volume and you can do a lot of care and a lot of procedures. As you start to look at a future payment model where a good clinical decision is now a good business decision, and that decision might be not to do that procedure or not to deliver that care, that could significantly financially damage you under the current terms. So that clean transition and a successful transition to a different model of care, people are really worried about that. We've been able to achieve that in some of the services and delivery models that we currently do, and I think people really want to learn from that. The patients are happier when they don't have to be in the emergency department. Patients are happier when they don't have to be admitted to the hospital. It's a better experience. It's certainly less expensive. But a lot of that happens outside of the emergency room. Think of the ER as the ultimate sort of failure in a chronically ill patient's care. Sometimes it's inevitable, but when it's preventable, it is just a better option for everybody. We're going to make the impact on that based on coordinating care, based on making sure patients have access, based on making sure that the patient's overall severity of illness is understood. Emergency department patients, you can take care of them and you can do the best you can as an emergency room doctor, but once you make that transition from they're in your emergency department to I'm going to send you home with good follow-up, it's that with good follow-up that's so important. Our tools are able to look at access. Does this patient actually have access? Do they have a primary care physician who actually has the ability to see them? Are there gaps in care? In a patient that I'm discharging from the hospital, is there just a geographic gap that there are no primary care physicians, so I'm sending them into a sort of desert of availability of care? Those are patients that are bound to come back to the emergency room, potentially being worse than they were. So, that's a place where we can a very small and very discreet place where we can help. We're finally starting to see some alignment between the hospitals and the patients and the physicians in terms of how you should incent people, how you should be taking care of people on a long-term basis. So that's a great time to be involved in healthcare. So having care coordination available when you're making these transitions of care is important. The emergency room tends to be an inflection point in your care. You come into the emergency department, you either get admitted to the hospital or you go home. At that particular point, whether it's a decision to go inpatient or whether it's a decision to go home, that transfer of care to someone else and that transition in care has to be done very carefully. And it's a really important thing. If you don't get that right, that patient who goes home may well wind up being admitted to the hospital later because they didn't get the right care, or they didn't get the right follow-up, or they weren't educated around their care. The best way to make the patients aware that something has changed is to change their care. The best way is to coordinate their care. When somebody calls from the hospital and says, we've noticed that you missed 2 appointments, that tells you that something's being done differently at the hospital level. When a patient arrives at the hospital and all their medication lists and everything have been managed through our healthcare information exchanges, and when they arrive at the hospital, all of that is there, they know something new is going on. And I think that that's where the best impact can be made from a hospital and from a provider point of view, is in actually making those transitions better and making the care a better experience for the patient.